Okay, I still don't see, what's your name? All right. We are going to get started so we can be good stewards to everyone's time. My name is Marsha Ellison. I am president of the NAACP Fort Lauderdale Broward branch, and this is our February, one of our meetings. We decided to not hold our business session because this meeting and this information is so important that we have to get out to our community. And as always, we are going to open up in prayer. I think Minister Edwards is still struggling to get on, but I don't want to hold people up. So, with that being said, let me double check, make sure she's not on. Okay. Judge Holmes, if you will open us up in prayer, please.
Madam President, and to all who are assembled here. Father, we thank you tonight for your many blessings. We thank you for life, health, and strength. And God, we thank you for the NAACP and our president, President Ellison, who have thought about the health of our community. God, we ask you to bless the participants and especially the speaker as she imparts knowledge to us regarding this COVID pandemic, that we take away from this things that we need to preserve our lives, because you said in your word that you wish above all things that we prosper and be in health, even as our soul prospers. Bless us, everyone. This we pray. Amen.
Amen. Thank you so much, Judge. And we will get right down to business. We will ask our All Things Health, which is among many hats that Jasmine Shirley wears, including sitting on our executive committee as our parliamentarian. She works with us on our GOTV efforts, and also she works with our health, so she is our pseudo health chair to make some. And Judge, let me just say this: I know that the commissioner may not be able to stay, but I wanted him to just pop on and say hello to the people. He's been out. I've seen him at different venues, but I wanted him to let you know that there may be some changes depending on where you are, but that he is on the job. So very quickly, Commissioner Tori Alston.
Thank you, Madam President. Good evening, everyone, and I will be brief. It is good to see the Fort Lauderdale Broward branch of the NAACP, my home, your home, and to the viewing public. Thank you again, Madam President. I'm honored to serve as the County Commissioner representing District 9. I think you all know I'm a 33311 baby, proud, born and raised, NAACP son as well, and a proud life member. So thank you again, Madam President. As we reflect on this 8th day of Black History Month, I want to make sure that we definitely lift up all of our justice giants, as you heard me say just a few hours ago when we were together recognizing you and others for Black History Month downtown at the county building, and all of our Black pioneers here across the state of Florida and in Broward County. So whether it's Harry T. Moore, Harriet V. Moore, Eula Johnson, Dr. Mizell, Dr. Shirley, I want us to all keep in mind all of our pioneers, of course, here in Broward. And with that, I'll just end off quickly, Madam President. Black history is American history for those who did not know. So again, thank you for the opportunity. I am glad to serve, happy to work with my branch as a life member, and looking forward to work with you on your leadership, Madam President. Thank you.
Thank you, Commissioner. And health is a civil right, so that's why we are very serious about the business of health. Ms. Jasmine Shirley, please take it away.
Thank you very much, Madam President, and thank you very much for all of those who are in our virtual world and have taken the opportunity to join us for this evening. This evening's presentation, as you know from the marketing information that was put out, is entitled The COVID-19 No More. As the pandemic continues, we have to be that change. So that's what we're going to be about this evening. We will be providing comprehensive information in the form of a frequently asked kinds of question-like format with everything that we would need to know, from basic information to testing information to prevention information to information about the vaccine information about variants and what does all of this mean, and how are we going to know the facts, make those changes that we need to protect ourselves, our loved ones, our families, and our communities. Before I get started, I just wanted to briefly let Madam President know, as Commissioner Tori Alston talked about those medical pioneers, that we all keep our prayers lifted up for the Hamilton family. Dr. Hamilton, Edward H. Hamilton, as you well know, was also a well-known physician here in Broward County, transitioned this life this past week, and his funeral services are being planned or have recently been planned. So we can all just remember his family and keep his family in prayer. It's my pleasure now to introduce you to Dr. Cheryl L. Holder. Dr. Holder is an internal medicine physician who has dedicated her career to caring for underserved populations and promoting diversity in healthcare through a pipeline of programs. She is a founding faculty member at the Florida International University Herbert Wortham College of Medicine. As the Associate Dean for Diversity, Equity, Inclusion, and Community Initiatives, Dr. Holder integrates diversity, inclusivity, and social justice in all of the FIU Medical School's programs and operations. She also teaches medical, nursing, social work, and physician assistant students about working in underserved communities through the Green Family Foundation Neighborhood Help Program. She began her career in 1987 as a National Health Service Corps Scholar, working with medically underserved communities in South Florida. In 1990 to 2009, when she served as a medical director for the Jackson Health System's North Dade Health Center, where she developed an HIV care and treatment program and directed the first school-based health centers in Miami-Dade County. She's a medical school graduate of the George Washington University School of Medicine in Washington, D.C., a member of the American Board of Internal Medicine. She's written several publications. There's just so many to enumerate. She's the award recipient of several awards. Those that stick out for me: Spirit of Excellence Award with the Dade County Medical Association, the Community Advocate Award of the National Medical Association, and a plethora of other awards throughout Miami-Dade and the state of Florida. It is my pleasure to welcome Dr. Holder. I have been an admirer of Dr. Holder since her early days in Dade County, which was actually my mid-career when I first met her, when she was the medical director of the operations of the North Dade Community Center. It's my pleasure to welcome Dr. Cheryl Holder. Dr. Holder, as we get started, I was telling you that we wanted to do this conversation as if I was sitting in your living room, we were just girlfriends talking, and you're trying to explain to me what I need to know to protect myself and my family, because I have a concern about the fact that 2 years down the road, we are still dealing with the COVID pandemic globally, and it's hit hard not only in the United States, throughout the state of Florida, but in Broward County, South Florida as well. We're in that plethora of what's considered those highest rates of infection areas of our particular state of Florida, being that Broward County is just above Dade County, and whatever happens in Dade County, we know it's going to be just as bad in Broward County. So we've been through this now for two and a half, almost 3 years, but 2.5 years, let's say. We first discovered that something was creeping around the world and eventually going to get us with all of the kinds of traveling that we have and how we can quickly get from point A to point B in a matter of hours, whether it's by boat, train, or however we manage to maneuver our traveling these days. So as late as mid-November to December, I think more like October, November, when I first began to hear things from some family members in China, to be exact. We knew something was going to be up. But then by January of 2020, we definitely knew the United States was headed for having to deal with the impacts of COVID-19. So we've known about this coronavirus for many years. I mean, 30 plus years they've been studying coronavirus. But this novel coronavirus, this COVID-19, can you explain to us, what is COVID-19 and how does COVID-19 spread?
Well, good evening, and thank you for having me. It's an honor to work with the NAACP over the years and hoping to get more people educated about coronavirus. And when we talk about COVID-19, that's a disease that's caused by the coronavirus infection. And like you said, 2019, it's named SARS-CoV 2019, coronavirus 2019, because it was discovered in 2019. And it's a member of the SARS family, which is a virus that has been around for many, many years. And coronaviruses are around. It's most of what causes colds, coronaviruses. But in 2019, this virus changed. And it changed in a way that was incredibly new, that no one in the entire planet, we have 2 billion people almost, or maybe a little bit more. No one has ever seen this virus before. And an infection that is brand new means that every single person is susceptible. So when you look at how long it takes to go around the world, yes, it makes sense that we're here 2 years later. You just have to do the math, because no one has ever seen this infection before. So no one has ability to fight it off. You have to develop that ability by getting an infection. So what you're seeing is natural cause of every virus that no one has ever seen. So what's COVID-19? After you get this infection, how sick you get is determined by what your body is like. And that's what we call the host. And how sick you get is determined by how much virus you get exposed to. So our management and our addressing this virus is basic. How strong is the host? How much protection does the host have to fight it off? And how much virus you're going to get exposed to. Basic approach to every infectious disease that you're out there with. So it's not surprised that we said, block the virus from getting at you. That's why we say, wear the mask, wash. We didn't know initially that this was in the air, how we transmit it. First, since it was so new to the world, they thought maybe it was just touching. Or maybe we knew it spread, but we didn't know it hooked onto the particles in the air and all the molecules in the air and comes in. When you're breathing, you don't see everything that's in the air. It's invisible, but the virus can hook onto these things. We at first thought it was that you had to send it out, project it out. But now we know it's in the air and it floats around and it's very infectious. So that's why we said, wear a mask, stand back, wash your hands so you don't infect yourself. And that was the basic protection. So that's where we are with COVID-19. You get infected. If you have a body that's not too strong, you can go on to severe disease and death. If you're very young, like a newborn, you don't have the immune power to fight it off quickly, so you get sicker. The middle group of young people, their bodies are ready to fight and they will get it and they may not feel it. They may get a little sick or they'll get very sick, but they don't tend to die. But it's the sicker and the older you are, the less likely your immune system can build up the defenses fast enough to fight a virus that multiplies billions and billions of particles a day. Think of a mom and a child. They can make a billion of themselves. And your cells can't make billions to fight it off. So that's the battle that you're in an infection.
So this science seems very easy to understand. It's spread through respiratory droplets in the air that get into the body through a number of mechanisms.
Primarily the nose, and goes back and goes down into the throat and into the lungs. Pretty easy.
Very, very easy. So that's the importance of some people talk about the 4 W's. Wash your hands, wear your mask, watch your distance. So it all makes sense. It all makes sense on how the basic things that we can do to protect ourselves and our loved ones, and to make sure that we follow those W's. Wash your hands, wear your mask, watch your distance, take care of yourself and your household the way we need to do so. So
and that explains why indoors is more dangerous than outdoors, because floating around at a higher concentration, So if everybody indoors talking and spreading the virus, circulating, you're gonna get it. So again, that makes total sense. So you should be able to figure out your risk. You walk in someplace, you don't need a PhD, you don't need an MD. You look around, you see a whole lot of people without masks. You don't know who's infected or not. We know the rates at some point in Broward went up to 30-something%. So you walk into a crowded room, a third of those people have the virus and they're spewing it out as they're talking. So you know your risk is high if you're unmasked. If you're
Yes.
masked, you reduce that chance. And if you stay out of that crowded room, you really improve your chances. Again,
Thank you. That makes sense.
you don't need a degree to sort of realize how to protect yourself.
And then there's so many people that may be sick or may not be sick, not showing any symptoms, but people who are not showing any symptoms can indeed still be expelling the virus into the
Yes.
environment for other people to breathe in or take in some kind of a way.
That's how tricky this virus is. I mean, viruses are like humans. They want to live. They want to survive. They want to multiply. They want to take over. So this virus develops a level high enough on infection early, so you don't feel it, but it's able to pass it on and infect others. I mean, that's a perfect mechanism to survive and keep thriving in any environment. That's what viruses do.
So tell me, Dr. Holder, so what should I do if I get sick? If I've been exposed, you know, stupidly was in a crowd and didn't wear my mask like I should, didn't wash my hands like I should, didn't pay attention to all the basic things that could have offered me some kind of protection. You know, back then we didn't have the vaccine that we now have. So we had to do a lot of those basic things to help ourselves. But so if I do get sick, what should I do if I get sick or someone in my house gets sick?
Okay. When we say you get, first you think you got exposed, and it takes about 3 days before you feel symptomatic. So if you're feeling sick, that means you're exposed about 2-3 days before. And then you ask yourself, how strong is my body to fight this off? So what you do is dependent on how strong you are. What is the host? If you are 65 and older, have chronic diseases. If you're younger and have severe diseases, have chronic diseases, asthma, any kind of immunocompromise, lupus, diabetes, obesity, heart disease, your body is not ready to fight. And early on, we recommend if you get exposed and you're feeling sick, go get treatment. And this is the beautiful thing compared to 2020 to now to 2021 and 2022, when we didn't have anything early on. So people got sick and they went to the hospital and they were dying. Now there's no reason, if you get sick, you go, whether you have runny nose, cold, go get your COVID test, because it looks just like a regular cold. You can't tell me it's allergies till you get tested. So any kind of runny nose, fever, chills, not feeling so well, go get tested. If you're positive, especially if you've been exposed to someone and you're positive, and you have any kind of illness, go get the monoclonal antibodies if it's available for you. Doesn't always mean it's available. That's the best treatment to prevent it. We also, to prevent severe disease, we also know there's some other drugs, so mild to moderate, that is now on the market. 2 drugs that are emergency use that you can also take if it's available. It's not available readily, but you can also take if you had mild to moderate disease. But the key is early symptoms. And these are the folks who know their bodies are not going to fight it off. Diabetics, hypertensive, I say even 50 and older with obesity, with any kind of chronic disease. It's best to prepare your body. If you're unvaccinated, definitely go get help, because more than likely you might not do well. If you're vaccinated, all it tells you is that your body is already ready to fight. So you're a little bit ahead of the game. But if you're sick after you've been vaccinated, you should still get, if you can, some of the treatments that will knock it out and you won't go on to severe disease. Our real goal is to stop you from getting severe disease and death, stop you from ending up in the hospital, and have you ride this thing out at home. And that's the goal of any plan that we have with infection.
Thank you. truly makes sense to me now. And I understand, Dr. Holder, I was infected in late 2020. I guess I was on the end of that Delta, right in the
Yeah.
middle of that Delta
Yeah.
peak. And I also have a chronic condition called sarcoidosis.
Oh, yeah.
So, when I first felt my symptoms, I knew something was wrong. So I immediately began to take my temperature, get a pulse oximeter, start recording and keeping a journal of everything. So I figured that if I got really sick and now I'm at an emergent state, I need to get to the hospital and I won't be able to talk or say anything. At least I'll have all the information written down. So over 3 days, I took my temperature every 4 hours. I took my blood pressure. I took my pulse oximeter reading, my heart rate. I just wrote all that stuff down. And any change that I saw over those 3 days, I would write the time, the date, and what was I feeling. So I'd have something to give to somebody in case I couldn't speak it out myself and advocate for myself. So, and that happened to me. In fact,
the good thing is now we don't need to do that. And we just say, go get treated.
Yes, but I didn't know that then. So
but it wasn't available that then.
Right, we have come so far.
It's evolving, exactly.
It's evolving, yes, that's what I'm trying to, it's evolving such now that we have different things now that we didn't have when I got infected, when I had to be hospitalized. And I had to recognize when I should seek emergency care. When I couldn't get my fever to come down below 103 after 3 days, I knew I was in trouble. And I hightailed it to the emergency room.
Right. And now what we're recommending is that we know what happens with people with any kind of immunocompromise, any kind of chronic disease. Within the time your exposure, we don't even wait. If I have a cancer patient recently who was exposed, her husband was sick, I'm like, you go get the treatment. Don't wait to see what happens because we know you're not going to do well. So it's like, go get the monoclonals. And this was before the Omicron variant knocked out half our monoclonals. But she was able to go get monoclonals. She didn't even test. We didn't even wait for her test to come back positive. I said, go get treated because while you're waiting, the virus is rapidly multiplying and you may not be able to beat it. So get the treatment that would fight it if it's in you. So that's where we are. We're saying, get your body to fight it early, 1 to 2 days. You know you're exposed. If you're cancer, immunocompromised, sick, go get treatment. If you wait 2, 3 days and you're having symptoms and you have any of these within 5 days, go get treatment. Because don't take a chance to see where you're going to end up. I don't know for your body, don't take a chance. And that's what we're trying because you get the medicine, you're better in 2 days. Now, if you're vaccinated, we know you're going to be better in 2, 3 days. Most people who get sick with the vaccine, especially if they're boosted, they don't get severe disease, even if they have any kind of underlying diseases. We're recommending if you've had underlying diseases and you're weakened again, you qualify for that 4th shot. It's just to keep the body primed, keep the body ready to fight because the virus is out there. And you got to have your own body antibodies to keep fighting anything that comes at you. And it works. We've seen severe disease decline. The people who died in the Omicron rage pretty much were unvaccinated. The ones who were vaccinated or boosted had severe medical problems, cancers, renal transplant, very sick. But if you didn't have any of those and your body was ready to fight, you pretty much avoided severe disease and death.
So Doc, when people say antigen, they mean the virus? When we talk about testing, antigen versus antibody, explain that to us.
Okay. When we test, the antigen is the little foreign things that are partly that your body reacts to. So we call anything like a virus, a bacteria that can create antigens. So your body says, this is the foreign substance that we check for. And that's what the antigen test does. It basically, you put it in your nose or in the back of your throat. And now the test in the back of the throat is just as good as the one in the nose. So you've been tested recently, they're going in the throat because we know it goes in and comes down. It's about how many little children it bore as infected. So it can have millions of particles in the back of the throat. And then you find the little pieces of it. So it's like little think of the virus being chopped up, and the test will pick up little pieces of it, and that's the antigen. When your body gets it, one of the first things your body does is make antibodies, which is the substance that neutralizes the effect by blocking those antigens. And your body creates enough of this substance that we test the blood and you see that you have antibodies. And that doesn't tell you when your infection is, because we don't check how high the levels are. All it tells you is that you were infected with coronavirus at some point. So that's what antibodies do. When we check the test, you're thinking of the PCR test or the rapid test. The rapid test looks for how much of those little particles are around. If your body hasn't made enough, the rapid test may miss it. The PCR takes that substance and amplifies it because there's some little ones that we can amplify and see that it's positive. So the PCR is the test that definitely finds a teeny amount of virus, and it'll tell you you're positive. While the antigen, you need a lot of it to tell you're positive. So that's why people go, oh, my rapid test was negative, and then they called me back and told me that was positive. It doesn't make any sense. It's how sensitive a test is. If the first one is just when you got a whole lot of infection, it'll pick it up. When you just have a little bit of infection, that first test may not, and the second test does. The second test is the goal, is the money. If that's positive, you're positive. And I've had people who told me, this was negative, but the PCR is positive. I don't believe the PCR. I'm like, believe the PCR. You're infected. You're asymptomatic, but you're still infected. You can still pass this on. And that's our biggest danger. So that's the confusion in the test. All the antibody says is that your body saw the infection at some point in your life and you mounted a response.
Thank you. So you've given us a wealth of information about the testing, the different kinds of testing, what the test is supposed to pick up, and the time frame it will pick up if there's enough of the virus in there that it can actually uptake.
Yes, that's why they say repeat 5 days. If you look, they'll say give it 5 days and see. If you think you've been exposed and you don't have any symptoms and you tested negative, check 5 days, because by then the virus has multiplied rapidly. That you should have enough to pick up on that rapid test in 5 days. You're just making so much virus.
And we've got many opportunities now to obtain testing. I mean, we can still go through to all of the testing centers that have been set up across the communities, whether they're run by the health department, whether they're run by community health centers or in your physician's offices. They have all these pop-up centers that are out on every other block now. We can get our home test kits that we can purchase ourselves. People can even
free. The home tests are free if you submit.
Yes, if you can get those. I mean, they can be.
I got mine already.
Yeah, I sent off for mine as well. I haven't gotten them yet. I'm waiting for them.
Yeah,
but there's so many opportunities. So
the libraries were giving them out. Most community health centers are giving you masks and tests. The libraries had the test. They're everywhere. And why we say test? Asymptomatic carriers. You get exposed to somebody within 3 days, you could have it, you're asymptomatic, test and find out, and then test again and see that you're negative. Two negatives probably definitely means negative. So this way you know for sure that you're not gonna pass it on. And you pass it on to somebody who will end up with severe disease and death. And that's our goal. We can test this, we can track it, we can contain it. And that's our goal, is to contain it so you know you're positive. Take yourself out of circulation, because it means that you're not going to go spread it to somebody else. And that's our only way to really get this under control, is that we all figure out how to test, track, and contain this ourselves.
Test, track, and contain. Okay, so I've gotten my test and they tell me I'm positive. And then they confirm it with that PCR and I know I'm positive. And you told me to take myself out of— isolate myself from those that I could infect, especially those in my household. So tell me, how do I tell the people that I'm around or that I've been around, how do I tell them this information? What do I say?
This is the tracking. Go back and say, where was I? Just call them and tell them, I found out I'm positive. there's no stigma or blame. There shouldn't be, because this stuff is airborne. It's the Omicron variant changed the story. That stuff, it's like measles. If you guys are old enough to remember measles, you kind of walk in a room with a kid with measles, everybody left with measles if you didn't have it. It's the same thing. If you're not protected, you walk in with Omicron. So you should just tell folks you're exposed and you should isolate. Once you have a positive test, you should isolate. That means you stay home for at least 5 days. If you're in a house without ability, stay in a separate room if you can. And when you leave that room, wear your mask, your N95 mask, and everybody stands 6 feet back, and it's unlikely you'll pass it on. If you're going to be vigilant in pretty much staying most of the time, 5 days for yourself. And if everybody in your house is vaccinated, even if unfortunately they get infected, they're not getting severe disease and death. And that's, to me, is a relief in a family. If you can say, yes, somebody has it, but everybody's vaccinated, so they're not going to get severe disease and die.
So when people say, your close contacts, so my household people are considered my close contacts because we're
Yes.
all in the same space.
If they've, right, so they would then be what we call quarantine. So where you isolate, they would be on quarantine. And depending on their vaccine status, that would tell you how much, whether they need to stay home in quarantine or be able to put on their mask, get their negative test, and go about their business, but to be careful and stay masked and avoid closed areas. Those are folks who are known exposed to somebody, and they're going to be what we call quarantine. They have to be in quarantine basis. But they would get tested. They would get tested at 5 days if they're vaccinated. If they're unvaccinated, their risk of getting sicker and staying ill longer. So we have those folks not go around. They should get 2 negative tests and then go back out. So those vaccinated folks we know are going to do worse. So we have them stay out of circulation longer. But if they're vaccinated, we know they're going to do okay. They can get their negative test, wear their mask, and go out. They don't have to stay locked in until they're proven negative.
This is so interesting because as we have evolved over time, the information has evolved, the science we have learned more about, so we know more things that we have to change or put in place. It's not like, oh, we did one way, now we have to do it another way. As the science changed, as we learn more, we have to adapt. Just like a virus has to adapt to survive, we've got to adapt to do the same thing.
Yeah, that's a great outlet. Virus is constantly changing to survive and to beat us. And for us to
we have to be flexible.
We got to do the same. We got to be as flexible as the virus.
That makes sense. So we've done some a lot of information in the basics and in the testing. So Ms. Burrows, Sonia Burrows, are there any questions in our chat from our virtual audience that we have not covered that someone still has a pressing issue on? For both basic information or testing.
Let me ask. So I saw a study about some of the testing sites that are along the highways are not necessarily the best route to go. They may be using expired tests or unauthorized tests or something on that. How do we go about determining if one of those tests that say free COVID test is actually the place that we should go to and get tested properly and get good information, Doc?
There's so many sites. The government has contracted with many folks, and like everything else, there's some folks who do it well and some folks who don't. During the surge, there were just so many people testing that some of these sites, because I went to a site on Biscayne Boulevard that was using a lab that was in Texas. I didn't get my results back for 5 days. When I went to Dade County site, that the big one at Miami-Dade, at the campus, Miami-Dade College, I got it back 24 hours. So the bigger government sites, you may be in a line, those are definitely going to do it. Some of the smaller sites, I find your federally qualified health centers, those are definitely going to get you back results timely. The biggest contractor in Florida that the governor gave the contract to is a company called Nomi Health. They had some difficulties because Nomi Health came out of Utah. So you are sort of, if you want to wait online, the biggest government sites are guaranteed to get you back in the best amount of time. Some of the smaller sites are fine, and you will try them and see, but the big government sites at Miami-Dade, at the parks, at the schools, at any of those federally qualified health centers, at some of the hospitals, those are guaranteed to get you back. Broward Memorial System, all those systems have sites, and those are guaranteed. The federally qualified health centers in Broward, on Hollywood, and in North Broward districts are pretty much, the parks are guaranteed. The others, many of the churches had done testing, because I do testing through a group called Keeping the Faith to Fight COVID-19. We connected with a company that we checked out the time. So many of your churches contracted and worked with groups that gave you good testing results. So your churches are pretty safe if you've worked with some of your church organizations. So that's the best way I could say, find the most trusted provider. Just like everything else, it's a brand new people that's just popped up in a corner, may or may not be okay. I took a chance with one. It took me 5 days. I said, I won't do it again. My brother took a chance with another one, and he got it back in a day. So it's hard, but Miami-Dade County, Broward County, those were guaranteed, the ones in the parks.
Thank you. We have that same issue here in Broward, where all of our community health centers, our hospital systems, all of our governmental type programs, which is the health departments, are partnering with various churches and what have you for testing and for vaccine dissemination. So we pretty much got great locations. Now we're beginning to see a lot of those pop-up shops, and people just need to ask the question, what kind of test is this? Is this a PCR? Is it a rapid antigen? You know, just start asking those questions and get the information that they should have available, their testing information. They should have something available in written form to provide to you.
And if you're getting a rapid, you know that the only
for basics and or
is if it's
testing from our
positive.
virtual audience.
Yeah, if the rapid is positive, it's positive. If the rapid is negative, wait and see what your PCR shows, especially if you've been exposed.
Go ahead, Sonia.
Yes, we did have one question. Are there, in terms of if you've gotten a positive test, are there any over-the-counter medicines that can be taken?
There's no over-the-counter medicine to kill the virus. What the medicines do is treat your symptoms, because it's like a cold, it's like it's worse than, it's like the worst flu. It's just a viral infection. So you can treat your symptoms with Tylenol for aches and pains, Motrin, that's it. Fluids, you feel better. If the virus is, if you have mild to moderate disease where you're coughing, febrile, there are pills that you can get, but those are not over the counter. They must be seen by prescription, and there is a shortage of them, and they do work for mild to moderate. If you're in the high risk group, like I described, you should get monoclonal antibodies if you're having any symptoms. Just to treat it, there's nothing that treats this disease that's over the counter. That's killing the virus, but you can treat symptoms just like you would if you got an ache and pain somewhere. But if you're high risk, like we've described, do not take the herbal supplements and all of that, think you're gonna kill the virus. Go get the real medicines to kill the virus and take your herbal supplements and your teas and whatever else.
Okay, we did have one other question. People are having problems getting the N95 masks, and they don't seem to be available at the Publix or Winn-Dixie, at least not now.
Yeah, those are difficult. There's a time when we knew that we said masking, you know, the whole masking thing was a problem. In the beginning, when they didn't think it was airborne, they said you probably didn't need a mask. Now we know it's airborne, you need a mask. Delta variant and the previous variants didn't get through as easily as the Omicron. So that change means the better your mask, where you get the fibers that block the air coming through, the better it is. You can get those I was in Home Depot, and if you go in the painter's aisle, they have the 3M N95. Don't get with the vial. They used to have them there. It's the same thing that not the particulate stuff that painters would use. It's the N95. You can get them online or a medical supply shop, and most medical supply shops had them. Online, you would see KN, that's the hard part, KN95 or N95. Which one are legitimate? There's a website, if you go to CDC, they give you a list of all the legitimate manufacturers that you won't get a fake one. And that's the CDC site. You put in mask and they'll give you the where to get it, which is the best ones when you go online to purchase. So your best bet is online. Free masks are being distributed at most of the community health centers. The federal government sent a supply to the federally qualified health centers. They sent a supply to Publix for free. So those are all, I think you get 3 or so. The N95 mask can be worn for over a week or two, as long as you don't get them wet and you don't soil them, because they have a particular coating on the outside that sort of reflects back the molecules that we don't see. So you don't want to wash them, you don't want to get them wet. Many times you'll see in the hospital, we'll have an N95, then you might see another mask that protects the N95 if you're going to get any exposure to any fluids, so that you always have an N95 to be able to reuse for several weeks. But if your N95 gets wet, you can't use it. The surgical masks, you can double up with them, as long as you got a tight fit. So I often tell folks, do the surgical mask if you can't get an N95, and then put one of the cloth masks and do a very tight fit so the air doesn't come under. And that will get you almost as much as an N95. The key is in the tightness of the fit and having several layers and not getting them wet.
So, Dr. Holder, for children, masks are recommended for children that are 2 years old or greater in age. So what mask do you recommend for children? Because you know how
The
children are there.
Whichever mask a kid will wear, it's tough. Most kids, if they're 2 and over and 3 and they're used to it. You get a mask that fits well, that gives the child a little room in the front. I wear one of those, they call them the duck looking mask. I wear it all day at work and it's very comfortable. So the key is in a mask that fits properly. So you get a mask that fits the child well, that the child can keep on and they don't chew on it and they're not going to get it all wet. You know, the problem with the kids is that they'll pass it on and bring it home. So the kids who really have sick family members and other folks at home, you should really get a proper fitting. If you can get them a fitted N95 or a proper fitting children mask and you put a filter in, that would help. That is comfortable for them. And they'll wear it if it's a comfortable fit. They often feel like a Superman and one of those cartoon characters, and they don't have a problem with masks. If the family is mask wearing and it's not a big deal for the family, the kids adjust very well if the mask fits well. Question?
Let me ask, is there, I know that some, not all Walgreens have them. I don't know what system they use for distribution, but are there any, other than say Walgreens, Winn-Dixie and Publix, are there any other centers, say like the urgent care or any of the hospitals?
Distributing the free test, the free mask and the
Free mask.
no, they're sending them to the federally qualified health centers. They're sending them to the Publix and those. I didn't hear them being sent to Walgreens, to urgent care centers where they were being sent.
Okay.
Other folks, I see a question here about somebody had the vaccine and the booster, but she was still hospitalized. You will remember the vaccine was never designed to prevent you from getting infected. This vaccine was designed to prevent you from getting severe disease and death. When you fill up the hospitals, you cause the healthcare system near collapse because there are other diseases out there. I have a patient who needed urgent surgery, but our beds were full. They had to keep delaying this person. There was nowhere to put this person. Had those folks been vaccinated, they'd have tolerated their disease at home and not gotten sick. Now, people who get boosted and get sick tend to have some underlying disease, and they should definitely go in and get evaluated. Because if they got sick and they're boosted, they should have gotten monoclonal antibodies, or they can qualify for the molnupiravir or the Paxlovid. Those are the two new drugs that we start early in infection. Sometimes they stay home. When we say quarantine home, it's not if you have any of these high-risk problems. If you're 50 and over, you got high blood pressure, diabetes, obesity, and you get exposed and you're positive, go get some treatment to start fighting this infection early. If you have a fever and it's day 3 and you have any of these things, go get some treatment. Why don't wait to see how you do? We don't have to do that anymore. 2020 we did because we had nothing to give you. 2022, go in if you have any kind of risk factors. Even if you're 30s and you have some sort of obesity, diabetes, anything, go in and get treated. How often should N95 masks be changed? You know, you can go a week or 2 if you really keep them dry. And even if you're not wearing a lot of makeup and stuff, if your skin is clean and you wear it, you're fine. Some folks put on a thin mask and then they underneath and they put the N95 so they keep it both clear. That gets a little uncomfortable, but you can get 1 to 2 weeks with an N95, providing you maintain it well. When you take it off, have a paper bag ready, put it in the paper bag and leave it in the car so the sun can dry it out, because UV light basically kills the virus. You shouldn't, I see a lot of folks touching the mask. The mask has blocked the virus. So then you're contaminating your hands.
And so the next thing you do is wash your hands.
Wash your hands. So that's why you're supposed to put it on, take it off, put it safely in a bag, leave it so the sun can get it, the UV light, and you're fine. 2 days.
And wash your hands.
And wash your hands. Wash your hands. Use your hand sanitizer. It's constantly. I see folks, and then they're messing with the mask. The mask is on. I'm like, no wonder Omicron hasn't stopped. They're not doing infection control.
So let me ask a question.
Go ahead.
So the Sistrunk Festival is in a couple of weeks. It'll be on the corridor and it'll be outside and it'll be a bunch of people, parade, the whole 9 yards. Other than don't go, what other advice do you have for
I
those
would wear a mask.
participating?
If the masking, outdoors, crowded condition, wear a mask because of Omicron. Had this not been Omicron, you could probably get away outdoor without the mask. Omicron is so much easier because the particle and the way it is, you don't need as much and it gets you. So wear a mask outdoors and go enjoy the concert because you're in close contact. It doesn't take too much of a virus that's billions of particles as you speak coming out. So you just put on a mask and go out. I would not go in a crowded area without a mask, just wouldn't.
So Judge Holmes, do we have any more questions on the prevention side of things that we can move into more discussion on the vaccine and the variant?
Not on the preventive. There is a question asking the doctor to please repeat those treatments that she talked about, monoclonal and then something else.
Okay.
One of our reviewers missed it.
All right. There are pills for mild to moderate for folks who have chronic disease. We're risk stratifying. So we know the people who go on to severe disease and death, most of them have something that their body means they can't fight. And that something is often a chronic disease. So we can give you pills. There are things called Paxlovid, which is 2 drugs in one, Paxlovid. The problem is the supply chain isn't there. So you may not get enough. There's one called molnupiravir. That's another one that we can give you. If you're pretty sick and you're hospitalized, you can get convalescent plasma. The best one we were giving was monoclonal antibodies. You go to the park, they give you a single infusion in your vessel, and that would give you enough antibodies, like what your body would have made, but these were manufactured in a factory, and it would fight the infection. The problem is that that Omicron developed resistance, so most of the monoclonals that we had no longer worked. And we only had one remaining and there wasn't enough of it. So even though there are pills that we currently have and there are monoclonals that we could use, the supply means that you may not get it. When Governor DeSantis got a supply of the one monoclonal antibody that worked, most of it did not come to South Florida. The only entity in South Florida that got it was a small nonprofit. Jackson got 187 doses. Most of the other hospitals got very little. So you cannot count on these medications being available. We tracked, the Black physicians, we tracked where did the pills, the Paxlovid and some of the newest pills go to. Boca got it. Other pharmacists in Palm Beach got it. No pharmacy in Broward got any of the medicines.
Wow.
You can't count on a supply chain and a system that distributes these drugs based on whatever reason they use on who gets it. But I can tell you, monoclonals did not make it to most of the Black communities. So if you are not aware that the treatments are there, but you may not be able to access it timely, put on your mask and get vaccinated, because the vaccines get your body ready to make its own monoclonal antibodies. You don't have to get the one we manufactured in a pharmacy or in a lab and infusing you. Your body makes it by the vaccine. Because
Could you say that again, Doc? Say that one more time, real slow.
the vaccine basically gives your body a little taste of what that virus looks like and tells your body, make a whole bunch of fighting cells and a whole bunch of antibodies that if I see this, I'm ready to fight. Because if you wait for an infection, you're not going to make enough in one day. It takes you about a week to make that supply to fight the infection. Then you go to some park to try and get a monoclonal antibodies, and it did not come to the Black communities in general. And when we lost all the monoclonal antibodies, except for one, when the supply came to Florida, it did not come to South Florida. The supply stayed in North Florida. So you cannot depend on pills and treatment. Paxlovid is a low supply. Molnupiravir is in low supply. They're not coming to our pharmacies near you. So your only option now is to protect yourself by getting a little exposure with the vaccine. It is safe. I don't care what anybody tells me. It protects you from severe disease and death. It was never designed to stop you from getting infected. So when my patient said, my patient got the vaccine, my brother got the vaccine and still got infected, I said, yeah, that's what we told you. It was never to prevent you from getting infected. But is your brother alive? Did they end up in the hospital? So the vaccine worked. Vaccine is common sense. Give your body something to fight. We do it all the time. We take vitamins, we take iron, we take foods to give our bodies to fight. When it comes to immune system, the only way to get antibodies to fight is either get a vaccine or get the infection. If you want to get the infection, you will get the fighting cells, but it'll take a week. That's why everybody feels sick for a week when they get the cold, because it takes about a week for your body to gear up to fight it off. You give coronavirus a week in a body that's not that strong, it's going to be dead.
Yeah.
That's what we've seen. 2,000 a day, 900,000 people in the US a year for the last 2 years. There are a lot of sick people out here that can't fight it off. The vaccines is your only mechanism now to build up your fighting cells. So when you get exposed to Omicron or whatever shows up, now how do we get variants? If you had a family and had 10 kids, do all 10 children look alike? Some are tall, some are short, especially Black families. Some are dark, some are light, some are medium. 10 kids all look different. You're making 1 billion particles and 1 billion more viruses. At some point, one of those viruses are going to be taller and stronger and better than the parent. And you know those families, they have that one kid who ends up being 6'4", and it's like, where did this child come from? What happened with Omicron? There were billions of deltas multiplying, and Omicron showed up. And I'm like, I got it. I can avoid this, I can avoid that, I can avoid that. So I'm going to live longer because I can get into all the cells and I can get in fast and I can make myself faster and I can make millions of my cells. And that's what Omicron does. It's a great virus in teaching us that nature is the best pressure to improve on yourself. And we do it as humans. Humans are way better, bigger, stronger than we were 2,000 years ago. The virus just does it like that. So we may get new variants. Of course, we haven't gone through 2 billion people have not been infected. And so once 2 billion people get infected and develop some immunity, then the virus will lose itself. But they say in the US, within the next few months, about 80% of the US will either have had the infection or have some protection from vaccine. So the next variant, if it's similar to its cousin Omicron, not as many people get sick. If the next variant has decided to be able to evade our immune system because it learned from Omicron, then we're in this whole process again. But we know how to protect ourselves. Wear a mask, avoid a whole bunch of crowd, wash your hands, stand back, and you'll make it through. And stay well. Black folks got to keep our vitamin D levels high. Vitamin D keeps your immune system working well. A lot of the folks who died early on, they found their vitamin D levels were low because the vitamin D works well to keep your immune system strong. So we got to keep our immune system strong and make sure our vitamin D levels. We got to exercise. We got to eat more antioxidants. Let's need more plants. We got to lose some of the fat because the fat is inflammatory. The thing that kills you is inflammation. And if you look at all the stages, the youngest kids will always tend to be much more fat because it causes more inflammatory response. So that decreases your immune system. So to keep your immune system, whole lot of vegetables, keep your vitamin D, get your sleep. We don't sleep well enough, especially Black women. We're working too much. Get some sleep because sleep helps your immune system. Lose some fat because too much fat worsens your immune system too. Increase your exercise, strengthens your immune system. Get vaccinated. Vaccinating is the prime. It gives you that little extra boost that day one, I get exposed to Omicron, I can fight. I don't have to wait till day 7. So it's very basic. And we're in this for another few years till this virus goes around the world. 2-point-something billion will be done in a few years. But in the time for the US, we are rich, we're protected, we're blessed in that we can do as much as possible to avoid severe disease and death and basically survive. The rest of the world is not so fortunate.
So Dr. Holder, we're also in our flu season. So we got flu and COVID to be dealing with at the same time, which have the same kinds of symptoms. So what's happening?
Wear your mask. You know, 2020, 2021 was the best flu season I've ever had because folks were much more vigilant with their mask wearing. We're having more flu for the last season because folks were being more relaxed. I tell folks, put on your mask. You know what? For every flu season, I tell you, wear your mask, especially when you hit 60s, wear your mask. It's the best protection against the flu. Of course, flu vaccine for the same reason. The flu is another virus that if your immune system is ready and ready to fight, which the vaccines do, all the vaccines do is tell your body, this is what you need to look for. I got my guns and ammunitions ready to fight. I don't have to wait for a week to build them up. I already got them. So flu season, mask, and vaccine. Coronavirus, mask and vaccine, wash hands, stand far. And we'll make it through. We'll have a great flu season like we did in 2021.
Thank you. So everybody sees why we have to know more about COVID, because this pandemic is going to continue and it's going to be around with us for a few years more until we get more and more of that immunity out in the world. And the only way that we're going to help protect ourselves and our families is to know more and to act accordingly to what the science is telling us to do, to make good common sense good behaviors, and practice what we preach. How many times did your mothers tell us a soft, well, I won't say that because my mom might have said it in a different way. And we're on virtual world and on TV. But you know what I'm talking about. I'd rather do what I need to do now. And if I had known more then, I probably would not have had the kinds of experiences that I had with COVID. And it is nothing to play with. I thought I was going to die. But I am here and I am smarter now, and I will get through this forever, however, and whenever we have to deal, for how long we have to deal with this. But it's going to take each of us to take that responsibility and to teach our children and our knucklehead cousins who don't want to comply. We've got to be out there, people, advocating for ourselves and for our communities and bringing folks together, even if we have to have another little on the couch conversation with someone. Call and let us know. Call the NAACP, call Holy Cross Health, call Memorial Healthcare System, call any of our federally qualified health centers, such as Broward Community and Family Health Center, call the Urban League, call the YMCA. All of these people have community health educators, or we call them community health workers, that are out there trying to outreach and educate to people to get them forward so that they can get the information that they need, telling them and assisting them. Call MODCO, Mount Olive Development Corporation. They also have workers out there that are educating and outreaching to assist people to make the next step to get their vaccine series completed, whether it's the Pfizer or the Moderna or the Johnson, whatever that is. Go ahead.
You can mix them up. You can mix vaccines in your boosters, get anyone they have. If you get Pfizer, get a Moderna, don't fear. Johnson, get a Moderna, get a Pfizer, mix it up. They're free. Vaccines are free everywhere. You don't need prescriptions for anything. Just sign up, go to Walgreens, Publix, your parks, your federally qualified centers. I know Dade where you can drive through. I don't know Broward, but there are other places where you just drive through. You don't even need appointments and go get it. For now, America has tons of vaccines.
Yes.
Free. If you have kids who go to FIU, there are vaccines like crazy at FIU. Just sign up and they'll give you vaccines. So they're everywhere.
Everywhere. No excuses. No excuse out there. No excuses. And we as a community have to be accountable for ourselves. And therefore we have to hold each other accountable because we're all depending on each other for the same air that we all breathe.
Yep.
Dr. Holder, I just want to thank you so much. Madam President, do we have any more questions in our virtual audience realm? This has been an exciting hour and a few moments or so. We could go on all night, I'm sure. But we want Dr. Holder to get her rest because she did say that we all need to get our rest when we take our vitamins and get our rest and eat well and exercise.
Yeah.
So, Madam President, I turn the program back over to you.
One more thing I forgot. Climate change is my heart. If you think COVID is bad, get ready for climate change. It's already impacting us. I have a TED.com, Dr. Cheryl Holder. You learn more about climate because so much of what we experienced came from all the pollution. That's why Black folks have been wiped out. We were wiped out in the flu pandemic in 1918, was it? The flu? We were wiped out then, and nobody talked about what happened to the Black community in the first flu pandemic, which is as bad as what happened to the Black community in coronavirus and what is happening in the Black community because of climate change. So we have to be vigilant. We need the NAACP. We need everyone protecting your life with a vaccine so you can fight for the next generation. Thank you.
Dr. Holder, we're going to have to bring you back for a climate change town hall as well.
Absolutely.
Okay.
Absolutely. Thank you, Madam President.
Justice, climate justice. We're all in. I believe Judge Holmes, you said you don't, because we don't want to leave questions unanswered.
Yeah, there were two questions, and I'll just go quickly. Dr. Holder, one of the questions was that you mentioned an additional booster. Do you need a prescription for that? How does that work?
No, the fourth booster, that's the fourth now.
Okay.
It's been approved for folks who are sick, immunocompromised, renal transplant, dialysis patients, pretty much anybody who you know, sarcoid, you should get your fourth. The studies that came out of Israel are very good. that showed if you're at all weakened, you must keep your antibody level high enough. We don't check how much antibodies is circulating to fight. So the only way we know to keep your antibodies levels up is to give yourself a little bit more vaccine. And what the vaccine does is say, uh-oh, got that foreigner again, let me make the fighting cells. Because our body doesn't stay fighting a coronavirus. Our bodies calm down after we fought the coronavirus, relaxes itself, and goes on to kill something else. Then we give the vaccine and says, uh-oh, I got infected again, let me fight. And that's what keeps you. So I recommend all my patients with cancers, severe disease, heart disease, immunocompromised, HIV, they're all getting the fourth shot by 4 months, they say by 5 months, 4 or 5 months, I'm getting the fourth vaccine. And that will take them another 4 to 6 months. That will take them through the winter. And then the summer, you're pretty much fine. And then we'll see what happens the next winter.
Just so that we understand the lingo, you got the
Yeah.
first vaccine, the second vaccine,
1
the
month later.
booster,
Booster 6 months.
and then so now,
This is the second booster.
okay. So do you need a prescription? That's the question.
No, nothing needs a prescription, but you do need to tell them why you're doing it. Okay. And not everybody will do it. You've got to go to there's a declaration where when you go to the health department or you go to the site, you make up your recommendation. You have to tell them that you have the chronic problem. You just don't get it. Unless you do other sites, and the other sites, if you're in a church and there's a way to prevent, we're going to toss it anyway, you can then document that the person says this, and rather than throwing out the vaccine, they're willing to take the vaccine. The health department allows you to immunize rather than throwing it out.
All right, so the question is, so if you have only had one vaccine booster, should you get boosters 2 through 4?
No. They're
Start
two,
over,
the
Doc.
complete, the way we say in this, there are 2 vaccines to complete your coronavirus series. There are vaccines like hepatitis B, you need 3 vaccines to say you're complete. Coronavirus requires 2 vaccines to say you're complete. After the 2, the first one in one, then it's usually 3 weeks or 1 month later, depending on which one you get the second. Now you're complete. 6 months later, you get your first booster. That has all been done. So if you've had 2 shots, go get the booster. If you had a J&J, go get a booster 4 months after. You don't have to wait till 6 months with a J&J. But nobody's getting J&J anymore. So many side effects and so many risks. So it's 2 shots. Within 6 months, you get your 3rd shot. 4th shot, which is our second booster, has been approved for immunocompromised and sick people because they did not mount a good response. Like I have a 92-year-old mother, 92-year-olds, and it's immunology. We can go through that a whole nother time. You need a type of cells we call T cells and B cells. And as you get older, your body and your bone marrow just don't make any new ones. So you just don't prime your system well enough to make a whole bunch. So you have to get a booster. So that's why very elderly, immunocompromised, renal dialysis, any kind of transplant patient, they got to stay boosted. Israel basically boosts everybody 65 and older with the 4th shot. And the data show that it saved lives. So that's why the US government approved, the CDC approved the 4th shot for those people. Should you get it if you're under 65? If you have any kind of chronic problems, you should be able to get that 4th shot 6 months after within 5 to 6 months after the 3rd one, the 4th.
All right, Laura, did she answer?
Yes, she did.
It came from one of our panelists, so I just want to make sure, because I got a direct
So,
message.
We don't have say everybody gets the 4th one, which is the second booster. We don't have that approval. But we know the sickest people have got to keep levels of antibodies high to avoid severe disease and death. Because they're the ones who got in the hospital. They're the ones who are dying, the sick people, because their bodies just didn't mount a great response.
Thank you, Madam President, and thank you, Dr. Holder. This is one of the best expressive and, you explained everything. Best one I've heard in since we got in this pandemic. Thank you.
Yeah, thank you. Our first Vice President, Sonia Burrows, has her hand up.
Yes, I have a question, Doctor. What are your thoughts on, say, we're getting our annual physicals now and getting our, like, your annual blood work? Would you recommend asking your physician, like when they're doing their CBC or regular blood work, could they do an antibody check to see what your antibody levels are when they're running the blood work?
What we know, we don't have the actual studies to tell you what are the best antibody levels that tells us you're protected. Those studies are coming. So having results saying you got antibodies doesn't tell us, so is that antibodies enough or not?
Okay.
So we have that in disease like hepatitis B. I can check your antibody level and know you don't have enough and you're not immune, and then I'll give you more. We don't have that test for coronavirus. It's coming.
Okay.
So for now, it's better to presume you don't have enough and get a booster where we know you'll get enough and you won't get severe disease and death. Because that's what we're trying to prevent. We're not trying to prevent you from getting it. We're trying to prevent you from getting severe disease and dying.
Thank you.
Thank you. Jazz?
This has been an outstanding hour and 15 minutes. This really we have gotten a wealth of information. We know what our marching orders are, and we know what we as a community have to do and what we as individuals have to do. Dr. Holder, we thank you, we thank you, we thank you. We thank you for that plain talk. You didn't sugarcoat anything, and you taught us in such a way that we can fully understand and comprehend and know what we have to do to lessen the impact in our communities and to protect ourselves and our families. For that, we thank you very much on behalf of the Fort Lauderdale Broward branch of the National Association for the Advancement of Colored People. Thank you very much.
It's an honor. Thank you.
And with that, I want to certainly thank the members of our executive committee, our first Vice President, Ms. Sonia Burrows, second Vice President, Ms. Ella Phillips, our third Vice President, Mr. Ralph Rachels. I see our treasurer, Ms. Alice Hughes, certainly our general counsel, Judge Holmes, our parliamentarian, Ms. Jasmine Searle, and to my cousin, Rosine, who is on here thinking that it was a Delta meeting that she missed. Yes, that just a few of us are just breaking in on your meeting, Rosine. And with that, thank you so much. And Judge Holmes, I don't think Minister was able to get on, so if you will close us out, I'd greatly appreciate it.
Madam President, thank you for this opportunity. And Father, we thank you tonight because you said your people perish for lack of knowledge. And there is no reason for any of us to perish after tonight. We thank you for Dr. Holder. We ask you to keep us strong. God, we ask you now to protect all of us. Keep us in good health so that we may do your work and your will. Take us from this place, but never from your presence. We ask in Jesus' name, amen.
Thank you so much. Remember, if you are not a member, please do so. The only thing missing from this struggle with you, we were chartered February 11th, 1946. The NAACP National will celebrate 113 years on Saturday, the 12th. Those of you may not know, we have a drive-through membership drive that's going on this coming Saturday. Please check your social media, your emails for more information. We need you. Environmental justice it's a civil right. We need to make sure that we stay informed and stay about the business of what's fair and what's just, and certainly equal and equality for all of us. And with that, thank you all. Have a good evening.
Thank you.
Bye, everybody.
Thank
Bye,
you.
Dr. Holder.
Bye,
Bye-bye.
Dr. Thank you.
Stay safe, everyone.
And you as well. Thank you.
Thank you.